Well, after more than 5 months, kids will be back in School District 2 buildings starting Monday. The question on many people's minds remains, is that the right call? Q2's Casey Conlon sat down with Billings Clinic's leading infectious disease specialist, Dr. Neil Koo, to find out more.
It's been 160 days since the COVID-19 pandemic hit Montana. Schools were one of the first entities to act after March's initial wave of positives, shutting down the following week and moving to remote learning the rest of the year. Next week, SD2 will welcome back more than 14,000 students in a world filled with new protocols.
I think the biggest challenge is trying to address all the individual risk factors that we kind of associate with the transmission of SARS-CoV-2.
Here are the big 3 steps right now. 1, everyone inside the building, kids and adults, will be required to wear masks. 2, classrooms and common areas will be sanitized in between periods. And 3, new block scheduling will be put in place to try and reduce interaction with an infected student who often is harder to identify than staff.
Because of the symptoms typically tend to be milder in children, they're not recognized as readily as a concern to parents.
Thus, many kids are only tested when symptoms become more severe, which has led to a much higher percentage of Montana's cases than the national average.
In the U.S., is about 2% of the total number of confirmed cases of COVID-19. In Montana, there's about 12.7% of the total cases that's been reported here.
Dr. Koo says the numbers are skewed because more asymptomatic adults get tested and come back negative. However, he admits kids tend to present more transmission problems, especially when grouped together.
By far the biggest challenge that everyone is experiencing is trying to go against all our instinct and drive to be very socially interact with people whom we are really close to, and that's certainly here in the hospital in the healthcare setting. We understand the implications of what happens when someone develops COVID-19. Without seeing that, it doesn't hit home to them to understand why these measures should be followed closely.
While most haven't seen a positive case in person yet, they likely will. Yellowstone County Health Officer John Felton said Monday it would be naive to think numbers won't rise after schools reopen. But Dr. Koo says the #1 key to mitigating an outbreak is masks.
The reason it is such a big deal is not so much to protect us. It's really primarily focused on those who are infected and they don't know it to infect others. If everyone was wearing a mask and there just happened to be a student or a staff member who are sick, even that will decrease substantially the risk of transmitting SARS-CoV-2.
In the end, the question of whether or not schools should reopen comes down to this.
Certainly, there is no, quote, safe as in the context, but we could make things more safer.
And coming up tomorrow, Casey will dive into the biggest problem areas of the school day, like hallway interactions and extracurricular activities. And Dr. Koo will tell us whether he personally thinks in-person instruction is a good idea.